All right, so today we have Vicki Harshberger, who is a registered nurse at ProHealth Care, and I will turn it over to her to more formally introduce herself and then dive into today's topic, which is recovery room nursing. So go ahead, Vicki.
All right, well, welcome everyone. My name is Vicki Harshberger. I'm a nurse at ProHealth Care. I've been a nurse here for many years. Back in 1995, I joined ProHealth Care. Prior to that, actually, for a year during nursing school, I was a nurse intern. And so it's been many great years here at ProHealth Care. Good experiences throughout the organization. Currently, I am working in the recovery room nurse, and that's a post-anesthesia care unit. This is the area where right after surgery, after general anesthesia or spinal anesthesia, patients will come here, and it's pretty fast-paced. We have to be ready for patients that are coming out of anesthesia and being able to manage situations according to the patient's needs. I've been a nurse here in the recovery room for a year and a half as a regular position. We need to be on our toes and aware of medications and medical diagnoses and surgical types of procedures that affect the patients as a whole. To anticipate any kind of needs the patients will need, and also be able to reevaluate quickly. So that's what I love. I love to be able to use my knowledge and my skills and assist the patients in stabilization. We usually have patients here in recovery room for about 30 minutes to 45 minutes, just depending on what the patient's doing. And we have criteria. Before a patient can leave our area, we have to make sure that obviously the patient is breathing okay, they're awake enough, they're able to cough and deep breathe, their surgical sites look good, there's no problems like with bleeding or swelling at that site, and obviously no pain issues. So there's criteria that we follow, but for the most part, it's 30 minutes to 45 minutes. So. All right, go to the next slide here. Back in 1993, I graduated with an associate degree at Madison Area Technical College. I am going to share with you the reason why I chose associate degree at first, because after high school, I was just wanting to get into the profession of nursing sooner. I did not want to wait that 4 years to start working, and I wanted to move on and have a family and start having kids. So this is the direction I went in, and it's been a great opportunity. It took me 2.5 years to get my degree, and I felt prepared. So that was a big deal. Feeling prepared was one of the benefits for me of MATC, because I felt like it focused mostly on the nursing process. As we're a 4-year degree, you're going to get just a general global knowledge of, like, I did economics when I went to Chamberlain. I did history, and I did religion. So it gives you a broader degree, broader knowledge about other things versus the specialty within nursing. In 2017, I graduated with that bachelor's degree. I chose to go back and do that because I wanted to increase my opportunity as a nurse. If I wanted to become a manager, or if I wanted to become an educator, I would need that degree. So I was able to do an online program which prepared me with my bachelor's degree. I did use my bachelor's degree after I graduated. It took me until 2017 to decide to do something else other than bedside nursing, and I did go into the educational route, and that was a great experience. All right. So currently, a day in a life at my bedside nursing, I kind of already touched on this earlier, but the biggest thing for me is the critical thinking and the problem solving, and just taking care of the patient's needs as they wake up from the general anesthesia or the surgery procedure. And I love to be able to use the knowledge that I have, and also I love to, look up information that I might not be familiar with. And we have a library through ProHealth Care that we have online, and some great resources that I utilize to continue with my knowledge base. I also have a certification within my field, which helps me be an expert in this field too. My favorite part about being a PACU nurse is just that, just being at that bedside for that patient. And I would have to say patients show such gratitude when I am able to, manage their pain, manage their breathing, manage their blood pressure, their nausea. Those are the things that we commonly experience here in recovery room. My least favorite is that I have on-call experiences, and sometimes I get called at 3 in the morning, and I have to wake up and I have to be ready to take care of a patient. And it could be in the middle of the night, and it could be a storm out there, but we just have to be prepared to come in. We have a need to be within a 30-minute time frame to get here. So that can be sometimes a little bit cumbersome too, but we just have to be ready. So that's my least favorite. Not too bad. Let's see, the equipment I need to use. I have the most significant is managing airway, knowing how to do a chin lift. If a patient isn't breathing well, we have to be able to lift their chin so they open their airway. Know what kind of oxygen devices a patient is going to need required, and not always needing oxygen, but knowing when the patient does and when they don't. Another thing I need to understand is pulse oximeter saturation, what is normal, when to do an intervention and when not. I like allowing the patients to gradually wake up after surgery. It seems like they do better that way, and it feels better for them. That's the biggest thing with that. If they're able to rest a little bit because everything looks great and they're doing well, then we just let them wake up slow. End-tidal CO2 monitoring is another piece of equipment we do. Those are, that's a judgment call according to the patient's medical history. Some of our patients have, and a lot of patients have problems with sleep apnea, and those patients sometimes retain oxygen or carbon dioxide. And so they need to have a monitor so we know how much they're retaining and or how little they're retaining, because there's interventions involved with that process. EKG monitoring, we take a EKG course every year to make sure that we understand EKG rhythms and how to manage them. And when is there a problem and when is there not a problem? When do we need to call that doctor, or a rapid response or a medical emergency? We have to be advanced certified in life support for pediatrics and adults. So that's with adults, we go through monitoring patients' EKGs, how to know how to treat them, when it's critical and when it's just something we can just continue to monitor. Sometimes we have issues with blood pressure. We have to know how to monitor blood pressures and what is normal for that patient, for that age, and for their medical history, and what we need to do according to that blood pressure results. Along with, so there is non-invasive blood pressure monitoring. That's with that blood pressure cuff. And then there's invasive blood pressure monitoring where there's actually an artery in your radial artery, and there's a line in there that measures your pressures, your blood pressures. It's a continuum monitor. So we need to know how to problem solve those kind of those pieces of equipment and manage them and know what to do about the results. So those are the biggest things that we do here in recovery room. My usual schedule here in recovery room is 8 hours. I need to be flexible. Sometimes if the unit is busy or we have patients that are needing to have surgery, those are called add-on cases. We may need to stay longer, but so we have to be flexible. In our usually we're out around 8 hours. It could be a little longer, 9 hours. So, but it's usually not too bad. Patient types, right here at Oconomowoc, we're primarily orthopedics. We do general surgeries, which is appendix, gallbladder surgery, bowel surgery, so bowel resections, and urology procedures like problems with people's bladders, and then gynecology problems to take care of those patients. And one thing I didn't add on is recovery room nurses need to be able to recover a patient after a C-section, which is kind of exciting. So my nursing opportunities here at ProHealth Care is my majority of my career. I started out in ICU, and my manager and my preceptors and my coworkers really helped me with my foundation in nursing. I did really enjoy that atmosphere, but I wanted something that was a little bit less weekends, less holidays, and also, to be honest, less stressful. So I went on to day surgery. I was cross-trained also at that time here where I'm at now in recovery room. And then I also did pre-procedure phone calls. And so pre-procedure phone calls are the calls that we do with patients like a day or two before surgery to tell them when to stop drinking, what to expect, make sure that they understand what they're actually coming in for, and go over medications and past medical history, and just building a relationship with that patient through the surgical services. Like I said, in 2020, I decided to do educator, and that's called a staff development specialist. And that was within the perioperative department. So perioperative is pre and post-surgical services. So I was great with mentoring new nurses and providing education whenever the managers felt like the staff could use that with new equipment, a new process, or maybe just lack of understanding why we do certain things. So I enjoyed that too. But the reason why I came back to recovery room is because I really missed that bedside nursing patient relationship. It's a great reward. The patients just really enjoy my help. I am a person that likes to have opportunities, and surgery and being a nurse gives us a lot of ability to change what we're doing, also add on to what we're doing. So one of the things I also do is I work in cardiac rehab, which is an area we help patients that have had like a heart attack or a bypass surgery or valve surgery with getting back and getting comfortable with exercising. And there's criteria we follow according to the patient's feels like how they're working and their blood pressure, their heart rhythm, their heart rate, and just talking to the patient and how they're feeling. And we have like treadmills and ellipticals, and we have weights, and there's just criteria we follow to help the patient get back to exercising to help them recover. And also it's a great support for patients, and it makes them feel really comfortable with starting up exercising at home too. So great experience there. A lot of nursing, patient education, which I enjoy too. One of my experiences is after I had my son, a year later, his pediatrician wanted me to be assist with a month worth of working in a pediatric setting. It was okay. A lot of vaccines. So I was obviously I didn't go back to it. Didn't really appreciate that feeling of the vaccine part of it, and it was more of a laid back setting. So I moved on from that. I didn't help. He didn't need me either, so it worked out good. Next slide. In closing, I believe that when you're a nurse, you should be certified in that area so that you can become an expert and keep up to date on what's new within your field. And I'd love to be a resource for other employees. So that's one way I can be that resource. Learning is essential, so we're a lifelong learner, and always look at ways to continue your education within your specialty. Any questions at all about that? Okay. ProHealth Care is a great place to work. It supports the employees, supports where they want to transition to. They are good with helping nurses figure out if there's a transition that needs to be made. The management's very in tune to their employees. Let's see here. And I really believe that we at ProHealth Care give great patient care. It's very important to me to give patient care, and I want all my coworkers and the physicians and every staff member have that great impact on patients' outcomes. And the salary is it's comparative, and the benefits are great. Any questions at all?
Thanks, Vicki. I just had a few things I'm hoping you could kind of elaborate on. So could you describe kind of what your team dynamic is, or other healthcare professionals that you encounter every day or have to work with? Just talk a little bit more about kind of what that dynamic looks like.
At first, the dynamic is when the patient arrives, it's getting bedside report from that anesthesiologist and the OR nurse. And after that, usually in a recovery room, it's all nurses. We do not have certified nursing assistants. So we work as a team. When we get a patient out from surgery, we usually work together and get that patient all organized, all hooked up to the heart monitor, the blood pressure monitor, the oxygen level or saturation. And we just assist each other. We work as a team. Sometimes we know when a patient should not be interrupted with a lot of stimulation. Like I said, we don't want to over stimulate patients either if it's not necessary. And so then we may choose as that primary nurse just to be able to take care of that patient without any assistance.
Thank you. I'm curious, did you ever consider going on for more schooling, or ever consider,
Yeah. I did consider to go on to be a nurse practitioner. But, I just figure that with my age, I am getting a little older, and, my goals of retirement and the amount of hours I want to work in a day, I chose not to move on. I know a lot of people are going into nurse practitioner roles, and I believe it's a great clinical choice to be made. But again, it's something that I chose not to do because of the amount of hours per week. I felt like right now with where I'm at in my career, and I just want to work 0.6, which is 3 days a week. and I haven't talked about that, but that's one of the benefits of being a nurse, is being able to work part-time, full-time, very little. Um, it's great because sometimes you want to work less, and sometimes you just say, I'm my life outside of home, because there's got to be a balance between work and family. You can choose to switch it up.
Yeah, that's a good point. Thank you.
Yeah. Yeah.
Any advice that you would give to high school students or students in general, or anyone interested in pursuing a career in nursing?
I think in general, if you're interested in pursuing nursing care, I think that you have to think about that I believe there is plenty of opportunities again. If it's not bedside nursing, it's working in like insurance for insurance claims, or it's being an educator, being a professor. It's just, there's so many opportunities. I feel like that's the best part about being a nurse. It's not just one simple thing. There's a broad amount of career opportunities. I think one of the things that I became a nurse is because I love making an impact on people, and I love to be there for people to help them feel better. I feel it's the biggest benefit of providing my nursing practice is the impact I make on patients. And so I feel that if you choose to be a nurse and you want to be a bedside nurse, that is the benefit, is being knowledgeable, being able to assist the patient in whatever they're going through, and being a companion. Depends on, the needs. So,
Is there any guidance you would give a student on how they could maybe get their foot in the door, or a good way to get started in
yeah.
pursuit of that path?
If you're wondering about if I want to be a nurse or not, starting out as a certified nursing assistant is a great way to do it. We have actually, through ProHealth Care, we have a CNA program that we help people that do not have their certification in nursing assistants. And it's a great way to look to make sure, because you're investing, time and money, and it's a great way to see what healthcare is about. Yes.
Great, thank you. Is there anything that you want to add that I maybe didn't ask, or you'd like to kind of conclude with?
I think that I think just in general, I think being young and not knowing, just look, talk to people, use your resources. If you don't know somebody within that field, figure out a way to do that, and just be your own advocate for yourself is a big deal.
Well, I think that's it then. Thank you everyone for watching this session. We hope to see you next time, and take care, everyone.